Welcome back to the Appleton Area Health Podcast. I'm Matt Tollefson, your host, and we are wrapping up our series on the Whole Person Wellness Program today. Really an exciting conversation with our newest provider in our clinic, Dr. Chase Osbon, and he introduces himself in this episode and talks about the importance of sleep, something I all think we could all probably use a little bit more of as we go throughout our life. Talks about some different ideas about how you can get more, some supplements maybe you can try, and then some practices that you can maybe put in your everyday life to help you get some more. Hopefully you find this conversation interesting. I really did, and hopefully there's a few things that you can take away to improve your sleep. Enjoy the conversation. Joined now by our medical director, Dr. Osbon, who joined us in January, right?
That is correct.
Joined us in January. So welcome. We haven't had you on the podcast yet. But tell us a little bit about yourself.
Thanks, Matt. I started here January 2nd, and I am a family medicine physician. I'm also the chief medical officer here at Appleton Area Health. I've been in the general area. I live in Montevideo, but we've been in the general area for about the last 7 years. Okay. And happy to be here, and I've been impressed so far since I've been here.
All right. What are some things you enjoy outside of work?
Okay. I do like to play golf.
Okay.
My daughter is currently on the junior varsity golf team in Montevideo. I like to go out with her because I can still beat her.
All right.
And I like to play with my son too. He's a senior at Ole Miss in Mississippi, and we will be going to see him next weekend for him to graduate. And I need to play some golf down there while I'm there as well too. My wife and I, Lindsay, we both like to cook. We like to eat out. Food is a big part of our, everyday life and activities that we like to go do.
Awesome. Okay, what's your favorite thing to cook then?
Oh, absolutely. Cajun food.
Cajun, okay.
Yeah, I would say that gumbo is probably my specialty. I can make it by memory at this point.
I've been hearing about you in jambalaya, right?
Yep. That technically, that jambalaya that we brought a couple of weeks ago, my wife made that. That's kind of her specialty. So I didn't want to claim that.
Sounds good. Sounds good. So like you mentioned, you've been here since January 2nd. What are your initial impressions of Appleton Area Health, and what do you see as some of the strengths?
And so as far as the strengths, I think that leadership, the other providers here are very, I would say, describe them as bold. And I would also say that there's a lot of out-of-the-box thinking that goes on about a lot of projects. I think that we have I think that the best thing about Appleton Area Health is actually our behavioral health team. I think that the nurse practitioners and the therapists that we have here are, for a facility in an area of this size, I think that we are just tremendously fortunate and lucky to have a group like that. And I've been impressed since I've been here with that group. And so that's been the biggest takeaway since being here at Appleton Area Health. I'd worked in the ER for a couple of years on occasion here before January this year. So I was familiar with some of the nurses and some of the inpatient hospital ER side of things, but I really wasn't too familiar with leadership and the clinic side of things. And so I have been impressed. I think that the nurses that we have on the hospital are very skilled, as well as the nurses in the clinic. They just know how to get things done.
Sure.
And so that's the kind of the attitude. I didn't create this. I'm not responsible for it in any way. I'm just jumping on board with this attitude of let's get it done. Let's figure it out.
Okay. Well, good. Well, we're glad you're here and you're a part of it and joining the team. So
thank you.
Yeah. All right, so we're wrapping up the Whole Person Wellness Program, which we've been talking about now for 5 episodes. This is our 6th episode on it. And we've covered mental health, we've covered the importance of community, diet, and the importance of preventative tests that our lab and our imaging departments offer. Now we're going to discuss sleep, which is a huge component of wellness, right?
Absolutely.
So where do we start? We always hear the general rule like 6 to 8 hours, right? Um, how do we get 6 to 8 hours in a busy life? That just seems impossible.
And so I would say that kind of going back just a tad, you as far as the whole person wellness talks that we've been doing, if you were to Google kind of the pillars of health, if you Google pillars of health, you're going to see a lot of different things out there. It's going to be the 3 pillars of health, the 8 pillars of health, the 10 pillars of health. There's going to be all of these different kinds of pillars of health, but for no matter any of one of these lists that you're going to click on, you're going to see 3 that are going to be in every list, and it's going to be exercise, diet, nutrition, and sleep.
Yep.
And I think that as adults, especially as busy adults, worried about our careers, worried about our families, all of the activities that go along with those 2 things, I would say that sleep is the thing that we tend to push to the back burner of the most often.
Catch up later.
Yeah, we do.
Yeah.
And we don't take it, I don't think that we take it serious enough in how much it really impacts our health as a whole.
Okay.
There are, it is recommended that adults over the age of 18 get 7 to 8 hours of sleep per night.
Okay.
There are a lot of people that get less than 7 hours of sleep a night. I think I saw statistics where 30% of people get less than 7 hours of sleep a night on a regular basis. And there are also a group of people that need more than 8 hours of sleep. And there are still lots of adults that, for them to function optimally in work and life and family, they need 9 hours of sleep.
Okay.
And now, as you kind of grow, as you're a child, you need, a toddler needs 12 hours of sleep. A school-age child needs 10 hours of sleep. And a teenager needs 8 hours of sleep, and that kind of stretches on into adulthood. And it doesn't change once you're 65 years old and older as well too. You still need your 7 to 8 hours of sleep per night. Now, how do we go about doing that? Now, that is a challenge. And so, what would you say, Matt, in your personal experience, how much sleep would you say that you get on a night?
The answer depends on how quickly my kids go to bed.
Okay.
Right?
Right.
So we have young kids at home, 3, 6, and 8. But typically, I'd say 6 to 7 is what I typically get on a typical night.
Right.
Yep.
And so if you're only getting 6 to 7 hours of sleep per night, you are not functioning at an optimal level unless you are one of the rare ones.
Sure.
Michael Jordan, Benjamin Franklin,
Yep.
Thomas Edison, John F. Kennedy, these types of people that do function on less than 7 hours of sleep, but it's very rare. Everyone thinks that they're in this rare group, but they most of them are not. I certainly am not.
Yeah.
I also function on less than 7 hours of sleep on a regular basis as well too. We typically make up for it in the mornings with caffeine.
Okay.
And so caffeine, what in medical speak, we talk about half-lives. And what a half-life is how long it takes for half of that substance to still be in your body, your bloodstream, your still being used in your cells and all of that.
Okay.
And half-life for caffeine is somewhere around 4 to 5 hours. And so when you drink that cup of coffee at 8 o'clock in the morning, and you have that second cup of coffee at around 10 or 11 o'clock, that's typically carrying you on through the workday.
Okay.
Now, if you continue that, if you have the Monster after work, if you have the cup of coffee after work, if you have 3 Diet Cokes with your supper, all of this is continuing to carry over throughout the day, and you're having to deal with this in your system late at night, and this could be part of your problem, and this is all too frequent a problem that people have is that they're just consuming too much caffeine
Sure.
on a regular basis. They know it helps, so they continue it, but it's actually kind of hurting them in the long run.
Okay. All right. So my big cup of coffee that's sitting back there. Maybe have a smaller one tomorrow. So
Right. Or just make sure that you're done with it by 10 o'clock and then really be mindful about what you're having for the rest of the day.
I have found for myself that like that 1 o'clock for me, if I have any caffeine after 1 o'clock, it is a little harder to fall asleep.
Right.
For me.
Right.
So, that half-life thing is interesting. I'm sure it affects everyone maybe a little bit different.
So, and there's a little bit of a range, and that's typically kind of like average.
Sure. Yeah. So, what about other practices? Maybe those folks that don't have too much caffeine in their life. What are other good ways maybe they can unwind and get ready for sleep or get ready for bed that they can add to their routine?
Okay. And so, for everyone, I would recommend if you're having any issues with sleep at all, if you're wanting to optimize your sleep, I would say no caffeine after 7 o'clock at night.
Okay.
If you're a Diet Coke person or a Diet Dr. Pepper person, they sell caffeine-free versions.
Sure.
They taste the exact same that you can have late at night. Now, also, a lot of people will drink alcohol late in the evening. They have a drink, a glass of wine, something to wind down in the evening. But alcohol, while it can make you drowsy, can interfere with the quality of the sleep that you were having at night. And so I would also put alcohol in that category as well too. I wouldn't recommend consuming any alcohol after 7 p.m. because of the negative effects that it has on your sleep. As far as winding down, our body naturally makes melatonin. As the sun goes down, our brain makes melatonin, and it is directly affected by light. And so as the sun goes down in wintertime, when it's getting dark at 5 p.m., we don't have much of a problem with this. But during the summer, when we have sunlight out until 9:45 at night, this can be a little bit of a problem.
Sure.
But we want to get, the rooms dark. We want to turn the lights out and start letting our body's own natural amount of melatonin to kind of take a hold and help starting the winding down process.
Okay.
Avoiding brightly lit screens, specifically tablets and iPhones, are when we're holding these brightly lit screens close to our face, that amount of light from these brightly lit screens can be causing problems with the whole melatonin system and the way that our bodies try to get ready for sleep on its own.
Sure.
And so I would recommend not using iPhones or tablets an hour before your intended time for go to sleep. And another thing that a lot of people tend to not think about is the temperature in their home.
Oh, okay.
And so the optimal temperature for sleep is in the low to mid 60s.
Okay.
So turning the thermostat down at night helps with sleep. But that's only if you're using cozy bedding and you're wearing pajamas, you're sleeping in a bed with a blanket and sheets and a comfy pillow and all of that. And so the optimal way to get prepared for sleep is to turn the thermostat down, make sure you've got cozy pajamas, cozy blanket, cozy sheets, and a nice fluffy pillow. That helps kind of get things ready for the sleeping process.
Yeah, I'm going to mention that to my wife then we get to turn the thermostat down because you said so.
If it's a money issue, turn it up to 72 during the day and turn it down to 65 at night.
Dual purpose. Perfect. Back to the phone and tablet thing too. So many times when you're on those devices, you're likely on social media anyways.
Right.
So there's potential for doom scrolling or anything like that, which anxiety producing too, and things like that may even cause more sleep issues too. On top of the blue light and things like that. So, yeah. Ugh.
In directly speaking to the tablet and the iPhone, and you might think that that's just young people, teenagers playing on those things late at night. You would be surprised when I have a 75-year-old husband and wife come in and they tell on each other and they say that Well, she's on the tablet,
Mm-hmm.
sitting in bed at 11 o'clock at night, playing Sudoku and things
Yep.
like that. And so doing anything stimulating, and whether it is doing puzzles or playing video games, and that includes anything that you're doing that's playing,
Mm-hmm.
watching the true crime murder mysteries on Netflix
Sure.
or TV at night. All of these are mentally stimulating activities,
Mm-hmm.
which is bad for sleep.
Sure.
And I would recommend trying to calm all of that down at least within an hour of sleep. And so
Okay.
if you're going to play video games, if you're going to watch that true crime doc before bed, I would make sure that you're turning that off an hour before you're trying to get to bed.
Okay.
And what I typically recommend when people come and they ask me, what can I do? What can I do to help with sleep? Everybody's heard the same things about from doctor recommendations or the commercials on
Mm-hmm.
TV and things like that. But I recommend watching something dumb on TV,
Sure.
watching something that you have seen a million times. If it's Seinfeld or King of Queens or Cheers or something like that on
Sure.
show, something that you've seen it a million times. You're not really engaged. It's just something on TV, and it kind of helps the process to get you drowsy.
Sure.
Now, the other thing is to read.
Yep.
And not read the mystery novel or the book that you've been waiting to read for
Mm-hmm.
2 months because it's so engaging. But I'm talking about just reading anything that is dull. Think back to when you were in chemistry class in high school all of those years ago,
Yep.
and the teacher told you to read your book, or you were just listening to the teacher read some slides in class,
Mm-hmm.
and about how drowsy you became. Now, nobody wants to do that. Nobody wants to
Yep.
just pull out a book and read, but these are the things that I would recommend.
Sure. What about supplements? You mentioned our bodies produce melatonin naturally.
Yep.
And when you go to, Walmart, for example, there's a lot of melatonin on the shelves.
Yep.
Thoughts on melatonin and other supplements like that?
And so, as far as if you go to Walmart or you go to the pharmacy and you go to the sleep section, there's a
Mm-hmm.
big section.
Yeah.
Almost all of the sleep aids, they contain melatonin, Benadryl, which is diphenhydramine,
Okay.
or there's also doxylamine as well too, is another one.
Okay.
And so melatonin, our body naturally makes it. Taking melatonin supplements is essentially harmless. Our bodies can kind of get used to its effects over time, but even taking it for long periods of time doesn't really show much adverse effects.
Okay.
My teenage daughter seems to have no issues with it at all. She takes it on a semi-regular basis, and she says that it helps. The problems with melatonin is that it can lead to a hangover effect in the morning, where you just can't wake up, where you're drowsy sometimes until noon the next
Yep.
morning. This is what happens to me, and so I tend to avoid melatonin as I am sensitive to that grogginess in the morning that's just persistent.
Sure.
And I don't want to take it at 10 o'clock so I can go to sleep at 10 o'clock and wake up at 7, but feel like I
Sure.
only got 5 hours of sleep last night. Now, it works. It's for pretty much all of these sleep aids, it's kind of different strokes for different folks.
Sure.
And so it's going to affect everybody different. Not everybody's going to have all of these adverse effects or problems or benefits or whatever. Melatonin for some people might not really work at all. It's typically dose dependent with the adverse effects like the grogginess and the drowsiness in the morning. So the bigger doses are more liable to cause that, but it's also typically the bigger doses that typically make people sleepier as well too.
Okay.
Now for I would say the other largest segment of the over-the-counter sleep aids or medications that include Benadryl or diphenhydramine. These, if you're getting ready for a trip or something like that, and you're like, I've got to be in bed by 11 o'clock tonight.
Sure.
So taking Benadryl or one of the sleep aids that contain the diphenhydramine, these can help. Your body can get used to taking diphenhydramine on a nightly basis pretty quickly.
Okay.
So this can be something to where it worked for 3 or 4 days and then it's not really working anymore. more. For some people, it doesn't really work at all. For some people, it might work great. There can also be a hangover effect associated with these Benadryl medications as well too. The best of the bunch is the doxylamine, which is if you go and you find Unisom sleep tabs, not Unisom sleep gels, but Unisom sleep tabs.
Okay.
They contain doxylamine, which is also an antihistamine like Benadryl, but it can also help and seems to have less of a hangover effect and might promote better sleep maintenance, staying asleep while you are, which might not get so much of that benefit with Benadryl.
Sure. Okay. Yeah, that's good to know, because for me, when I've taken melatonin in the past, it seems like I wake up in the middle of the night and I'm awake. Like I can't go back to sleep. So,
Right.
It's interesting. So,
there are others, like if you're into more natural supplements, valerian root is a natural supplement that they've been using for 2,000 years to help people sleep. I've tried this in the past. It doesn't really help me that much.
Sure.
There's not much downside to taking valerian root. It's another one of these things. If it helps you, great. If it doesn't, move on.
Okay.
And another one is magnesium glycinate. And this is one that's really kind of popped up over the last 10 years or so. Once again, it's magnesium. So there's not much of a downside to it. It might cause you to have loose bowel movements or loose stools and things like that, as that's kind of what magnesium does.
Yep.
But it also, for some people, it can be relaxing and help with sleep. And relatively, there's really not a downside to it. It just might not work for some people, but it works really well for some others.
Okay. All right. So just to kind of summarize what we've talked about today for sleep, get your room dark, turn the temp down, get a book and stay off the screens an hour before bed.
Get cozy.
Yep. Kind of watch your caffeine intake.
Yep.
And then, see if supplements, if you need, see what supplements might work for you.
Right.
So.
And I cannot stress the alcohol part of this as well too.
Yep.
You're drinking alcohol at night to help you go to sleep. You're sleeping 8 hours a night, but you wonder why the next morning you're feeling groggy. You're feeling like you only had 4 or 5 hours of sleep. I would say it's the alcohol. Just stop drinking the alcohol late at night.
Okay. All right. So is there anything else you'd like to share with our viewers, listeners, about yourself or about any other topics related to sleep or ideas related to sleep that you want to share?
I do think that one thing is, as a physician, saying the things that we talked about, if you're trying these things, if you've already done these things in the past, I would say, and they're not working for you, I would say that it may be time to come in and talk to myself or one of the nurse practitioners about your sleep, because problem sleeping, daytime sleepiness, grogginess, and things like that in the morning can be indicative of something else. Most commonly, sleep apnea, which is a big problem. Sleep apnea is typically identified by a spouse saying, my spouse snores loudly at night, and at times I think he stops breathing. And that can lead to, it's one of the most common causes of daytime sleepiness, grogginess, fatigue during the day. And it is assessed with a sleep study, and it's treated with a mask, like a CPAP or a BiPAP. I guarantee you know somebody that has sleep apnea and uses CPAP or BiPAP, but it can be a total game changer. And you can go from having a terrible life where you're falling asleep driving to work in the mornings and you're sleeping 9 hours at night and you don't know what to do, and you find out that you have sleep apnea, you get put on CPAP, and all of a sudden you're having the best sleep of your night and you don't go anywhere without your CPAP. Wow. Other things, it can be indicative of something else, such as like you might have diabetes, or your diabetes is not well controlled, or other, medical issues, thyroid issues. The list goes on and on. And this is why I would recommend talking with a provider. Yeah, come in and talk.
Yep.
Yeah. And there are some people that they need additional help with sleep medications, and there are prescription medications that you can take for sleep, but I will save that for the patients that come in to talk about it.
Sounds good. Well, thank you very much for your time today. It's been great getting to know you a little bit and for sharing your knowledge on sleep. We're definitely going to have you on again, though. This has been a lot of fun.
Yep.
So thank you very much.
Yep. Thanks for having me, Matt.
Thank you. Thank you for tuning in to today's episode of the Appleton Area Health Podcast. And again, this is the end of our series for the Whole Person Wellness Program. Thanks again to Dr. Osbon for being on the show. We'll definitely have to have him on again. Super interesting guest. And again, I hope you learned a lot about sleep as I did. If you'd like to schedule an appointment with Dr. Osbon or one of our other providers, or to learn more about the Whole Person Wellness Program, give our clinic a call at 320-289-1580. Thanks for listening and have a good day.